So another important concept is tied to the earlier discussion about myeloma not being or being preceded by what we call precursor phases. So one of the good things about myeloma is that early stage, what we call the monoclonal gammopathy of undetermined significance, is often present for 15 to 20 years before patients get myeloma. So that gives us a window of opportunity to try and do something to alter what would typically happen to those patients. And in between, we also have what we call the smoldering multiple myeloma, which kind of bridges the gap between monoclonal gammopathy of undetermined significance and active myeloma that needs therapy. The importance of smoldering myeloma is represented or highlighted by this figure on the right-hand side, where you can see that in the red line, patients with smoldering myeloma, nearly half of them will get active myeloma in the first 5 years, and another 15% of them in the subsequent 10 years. So the bottom line is, once you have a diagnosis of smoldering myeloma, there is a 2/3 chance that patients are going to get active myeloma needing treatment within the next 10 years. This is very different than what we see in the MUGUS patients or the monoclonal gammopathy of undetermined significance, where only 1% progress every year. So at 10 years, only 10% of them have progressed. Now, if we can actually identify people at high risk of getting myeloma, should we not be doing something about it? Should we really be waiting for these patients to develop some of those, what Dr. Rajeeve already pointed to as CRAB features? They can be very catastrophic. The first presentation could be bone destruction in the spine that compresses the spinal cord, or else it could be these myeloma proteins plugging up the kidneys and actually causing patients to need hemodialysis. So how the field has changed is that increasingly we would like to identify people who are at the highest risk to develop myeloma and do something at that point instead of waiting for the bad things to happen. It's also important to remember that the majority of the patients with myeloma gets diagnosed when one of those complications happen. Only a small proportion will get diagnosed with a MGUS or a smoldering myeloma. Now, if you do have a diagnosis of smoldering, we do have ways to predict, the progression of myeloma, the risk of progression to active myeloma. And based on the risk, we have done studies that have shown that an early treatment with just one drug, if need be, can actually alter the risk of progression and also make people live longer. And this has been replicated in other trials as well. And there are more recent trials which are looking at, instead of just using one drug, can we use a combination of drugs, like what we would do for patients with myeloma, and actually make these people not only live longer, but also reduce the risk of myeloma happening. So there are several trials going on. This is one trial which looked at 3 drug combinations and a transplant for patients with smoldering myeloma. And you can see that only 7% of the patients have progressed after 2.5 years, and almost all patients are alive after 2 years of diagnosis of high-risk smoldering myeloma.